Brush massage during pregnancy, also known as dry brushing, can be a relaxing and beneficial practice for expectant mothers. However, it's important to take certain precautions to ensure safety. Here's a step-by-step guide on how to perform brush massage during pregnancy. Choose the right brush. Select a natural bristled brush with soft bristles. Avoid brushes with synthetic bristles or ones that are too stiff, as they can be harsh on the skin. Timing: it's recommended to perform brush massage before showering, preferably in the morning. This can help invigorate you for the day ahead. Technique: start at your feet and gently brush upward toward your heart using long sweeping motions. Always brush toward your heart to promote lymphatic drainage and circulation. Use light pressure, especially on sensitive areas like the breasts and abdomen. Avoid brushing over any cuts, bruises, or varicose veins. Continue brushing each area of your body for a few minutes before moving on to the next. Pay special attention to areas prone to cellulites, such as thighs and buttocks, using circular motions. Avoid certain areas. Do not brush over the abdomen if you have any complications during your pregnancy, such as placenta previa or a high-risk pregnancy. Consult with your healthcare provider before starting any new practices. Thank you for watching. Don't forget to follow and stay informed.